Well, I'm O.P. Yadav. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. We know the results of total arterial bypass are far superior to the venous revascularization. Almost 10 to 15% of the venous grafts are blocked by 1 year and 2 to 3% thereafter, so that nearly half of the venous grafts are blocked at 10 years. As against that, we find the patency rates of arterial grafts, especially the internal mammary artery, is in high 90s even at 10 to 20 years. Therefore, whenever the patient is young, we would always prefer to have total arterial revascularization. But there are certain negative things about it. When we take bilateral mammary arteries, we devascularize the sternum. So if the patient is a diabetic, if the patient is obese, or if the sternum is very friable and fragile, and if the patient has chronic obstructive airway disease, which may kink the internal mammary artery, in those situations we make a compromise and go for a lima to the LAD, and rest of the heart is revascularized using venous grafts. But if possible, we should use as many arterial conduits as possible.